Hi everyone, myself Dr. Saikrishna, consultant dermatologist at Kolors Healthcare. Today I'll be speaking about the most common procedure almost done by every skin doctor in his own clinic, that is radiofrequency. So what is radiofrequency? It is a simple office procedure which uses the radiofrequency waves at a frequency of 3.8 megahertz. What are the indications for which radiofrequency will be doing? It is commonly used for viral indications like removal of warts, molluscum contagiosum, or any benign skin conditions like skin tags, that is acropodons, dermatosis, papulosa, nigra, that is DPNs, for removal of seborrheic keratosis, removal of actinic keratosis, and removal of lentigens, freckles can also be used. Apart from this, usually for surgical indications also there, that is for making an incision over lipoma or for the sebaceous cyst, or simple basic surgeries can be useful. And even for nail surgeries like keratosis and ingrown nail also, it will be very helpful. So before taking any patient for radiofrequency, first the history is more important. That whether the patient is on any medication, that is especially blood thinners. If the patient is having blood thinners, then chance of bleeding tendencies will be more. And whether the patient is having any tendency of hypertrophic scar or keratidal tendency, or whether there is any presence of active bacterial infection, fungal infection, or viral infection. So once this proper history has been considered, then we can remove the patient. And other most importantly, history of hypersensitivity. That is, usually we will be giving lignocaine for anesthesia effect. So if the patient is having any hypersensitivity to the particular drug, it also has to be considered. Moving on to the procedure, first we will be giving the anesthesia for usually in the form of topical anesthesia or injection anesthesia. Topical, usually we will be applying amlodipine, that is 2.5 peglocaine and 2.5 lignocaine. Or for injection form, it will be 2% xylocaine, with or without adrenaline, depending upon the situation. Once the anesthesia has been issued either in the form of topical or injection form, next we have to clean with the betadine. Then we'll be giving the injection form anesthesia to the base of the lesion. Next we have to hold the lesion with the help of a forceps. Then we'll be cutting in the base with the help of an electrode. Usually there are different types of electrodes, that is needle type of electrodes, loop type of electrodes, elliptical type of electrodes, depending upon the indication which we will be using. If at all some bleeding occurs, we will be having the coagulation probe also, which should be very useful.